Hi, my name is Skylar. I'm going to be performing how to don and doff PPE. I've already determined the type of infection control precautions I need to use, and those are going to be airborne precautions. I've already determined that there are the proper hand hygiene materials in my patient's room, such as paper towels, there's a laundry basket, there's a lined waste receptacle, and there's a biohazard bag for my PPE after I'm done providing care with my patient. All the direct patient care is now completed for my client, and I'm going to go ahead and don my PPE. Perform hand hygiene first.
While I'm donning the gown, I would make sure that I'm fully covering my torso from neck to knees, arms to end of wrist. I would tie and fasten in the back of the neck and the waist.
And then I would put on my N95 to make sure it covers my nose, my mouth, and my chin. And I'm going to put on my face shield to cover my face and my eyes. And I would put my gloves on to cover the gown. Okay, pause. After I introduced myself to my client and did the universal beginning steps, and I did all my care for my client, I would then go and take off my PPE off. For the demonstration purposes only, I'm going to take this over my head, but in real life I would just rip it off. And then I'm going to shimmy it down my arms, not to touch anything and contaminate it. And only touching the gown with my gloved hands. I'm only touching the uncontaminated part. I'm going to put that in the biohazard bag inside my patient. Off my face shield, I wouldn't take it off in the front, I would take it off in the back. And then put it in the biohazard bag inside my patient's room. I would take off my N95 and place it in the same receptacle in my patient's room. But for these purposes, I'm going to put my N95 back on so I'm safe. I would perform hand hygiene after taking off my PPE and using the paper towel. I would open the door to my client's room. I would put that paper towel into their trash can inside their room. I would make sure I don't touch anything on my way out. And I would go directly to the utility room to perform hand hygiene again, and I would go and document.